Well, Republicans spent many years vowing they'd immediately repeal and replace Obamacare if voters returned them to power. Maybe you voted for them for that reason. When Barack Obama was still president, the House of Representatives repeatedly passed replacement bills, knowing they'd never become law. But now Republicans do have the power to do all of that, to replace Obamacare, and they're having a hard time. The Senate still hasn't passed a repeal bill, and that may be a good thing, according to the polls, which show that only 17% of Americans approve of the GOP plan, to the extent they know what it is. To put that in perspective, that's 5 points lower than the approval rating in this country for Vladimir Putin. The question is, what would this plan do for Americans? Some confusion about that still. Health and Human Services Secretary Tom Price joins us tonight to clear it up. Thank you very much, Mr. Secretary, for coming on.
Thanks, Tucker. Good to be with you.
So you're trying to sell this plan to the public, but also to the Congress, and it's hard. It's always hard with this stuff. So if you were to narrow it down, tell me what the chief aim of this bill is. Is it to improve health outcomes, to control prices, or to expand coverage?
To stick to those principles of healthcare, making healthcare affordable, accessible, of the highest quality, and provide choices for patients. So it protects patients, provides more choices for patients, lowers costs, and strengthens Medicaid. That's it in a nutshell.
Okay, but but you didn't add to that expanding coverage.
Well, coverage comes when people have something that they want to purchase.
Right.
Coverage doesn't come when Washington tells you what to buy. The way that you get people to get health coverage is that you provide them with a product that they actually want, and that's what this goal is. That's what the purpose of this bill and reform is as well.
Do you think that people, and I don't know the answer to this because I haven't seen the polling, but is there evidence that people in the last election voted to replace Democratic leadership with Donald Trump because they wanted more choices in health care?
Well, they certainly wanted Obamacare to go away.
Yeah, for sure. They wanted Obama. It was never broke 50%. Now it's actually above 50% now that we're debating this,
But they wanted it to go away. It's important to know why they wanted it to go away. They wanted it to go away because prices are up, choices are down, folks don't have the kind of health coverage that they want. They may have an insurance card, but they don't have care because they can't afford the deductible. So there are all sorts of an array of things that are wrong with Obamacare, with the ACA, and that's what we're trying to fix. Now, it's not just through this bill. That's what's important for people to appreciate as well. This bill is one isolated activity. It's an important one. It's vital to have it, but it's only one isolated activity that's going in place with this administration to make it so that the health system actually responds to patients.
But I mean, I think it's worth paying attention to it. It's meaningful. So how would Trump voters be affected by it? West Virginia, for example, was like 68%, I think, of West Virginians voted for Donald Trump. About 30% of this whole state is on Medicaid. This legislation, I think, would reduce Medicaid payments. I think that's a fair thing to say. So how would they fare under this, West Virginia?
For those individuals on Medicaid who were eligible for Medicaid previously, there's essentially no change whatsoever. Over a period of time, those individuals that are on Medicaid but were able-bodied adults, they would transition to a personal market, a private insurance market that would actually be more responsive to them and allow them to purchase the kind of coverage that they want. Virtually everybody's prices will come down for the premiums that they pay for their coverage, and they will get coverage that's more responsive to them. So we strengthen the Medicaid system, we drive prices down, we increase choices. That's what patient-centered health care is all about.
So if this bill passed tomorrow in its current form, I know it's still being formulated, there would be no net loss of Medicaid dollars or people on Medicaid in the state of West Virginia.
Actually, for the next 2 years, there'd be no change at all to Medicaid.
Right.
The changes begin in 2020, and at that time, then Medicaid would grow, the amount of money for Medicaid would grow at a rate that's equivalent to the consumer price index that's for the medical services that are provided in this country. So that would be a rate that would actually cover the cost of the increased growth within the Medicaid system. Over a period of 7 or 8 years, that drops down to just CPI, Consumer Price Index.
Right.
But over that period of time, the individuals that would transition from Medicaid to the private market would then be able to have the coverage that they want, and that, if they needed it because of their low income, would be subsidized by what's called a stability fund. So more choices, lower costs, strengthening Medicare, making it so that we can have patient-centered health care in this system.
And so not fewer people covered by health insurance.
I believe. There's no way to predict it. In fact, CBO has a terrible record on predicting how much coverage. But I believe that there would be more people, more individuals being able to be covered with the system that's currently being contemplated in the Senate than currently.
So who loses? I see you've described who wins, but of course someone always loses. Who loses?
Well, the folks who want government to run your health care, they lose. folks who want the insurance.
Who are they?
Who are they?
Yeah.
They're the folks in this town right now who are opposing this, by and large, the individuals who are not in favor.
So they lose because they're disappointed, but who loses money on this?
The money gets spread differently, and the amount of money is actually more because, as I said, the increase in Medicaid is up by Consumer Price Index, and individuals are able to get to select the kind of coverage that they want. So choices make it so that the market of health coverage, if you will, responds to patients, not to insurance companies and not to government. That's the key.
How far are we from single payer nationally for catastrophic coverage? I mean, honestly, I mean, I'm even hearing conservatives
for catastrophic
always
coverage
been against.
only?
Yeah. Single payer for catastrophic coverage.
Yeah. I think that the consequences of that actually reduce the ability for you to get the kind of coverage that you want for the services that you
Well, that may be absolutely right. But this is partly a political question.
Two, I think the answer to that question has to wait until the outcome of this debate. If the Congress and the President are able if Congress is able to pass a bill and put it on the President's desk, then I think that you will be a long way away from a single-payer system.
For sure, but if you don't, we're closer to it. And would you be for it or no?
The devil's in the details. I'm not for something where the government decides what individuals, what's covered for individuals.
Right.
Because I know that when that happens, as happens in every other system that has it, then the government decides what equals health care.
Yeah. The
and
lobbyists
you don't.
decide. Yeah, and they get rich too. I've noticed that.
Well, that may be a byproduct.
Yeah, they're all my neighbors. Mr. Secretary, thank you for joining us.
Thanks, Tucker.